Hey guys, Dr. Mark Dailey with Anianta Chiropractic. You're watching this video because you clicked on an ad asking, why do I have low back pain? If you'll give me just 3 or 4 minutes, I will give you a really good explanation and explore with you just several possibilities and actually show you some x-rays of patients that I have seen in my office and what I most commonly encounter and see if it doesn't sound like you. Watch carefully. Okay, so today I'm going to answer the question, why do I have back pain? Sometimes it is a simple muscle sprain or strain. Now, if the low back strain is serious, the doctor or your primary care physician may recommend a day or two of rest, potentially cold and heat therapy. Medications might include anti-inflammatories to reduce swelling, a muscle relaxant to calm spasms, and a painkiller to alleviate intense but short-lived pain. Now, the kidneys can also feed back into the low back because they share common nerve roots. Kind of like when you have a heart attack, one of the symptoms is left side arm pain. Well, that potentially can be a cause of trouble, but usually it's accompanied by other signs and symptoms. So kidney pain symptoms might include a dull ache that's usually constant, pain under your rib cage or in your belly, pain in your side, usually one side, but sometimes it can be on both, sharp or severe pain that may come in waves, pain that can spread to your groin or even your stomach. Now, they might include more serious symptoms like a fever, vomiting, pain when you urinate, frequent urination, or cloudy urine, or blood in your urine. Now, the hip and the pelvis often cause low back pain. So as you're looking here at this skeleton, right here is the lumbar spine. So a lot of pain can come from the lumbar spine, but the pelvis is made up of 3 bones. There are 2 hip bones, also known as ilium, and then there's a sacrum, which is a triangular bone that actually fits in between the hip bones. And where it fits in, I'm going to show you in just a minute, is called the sacroiliac or the SI joint. Now, looking at the pelvis up close, and this is an x-ray, what I want you to see, the blue arrow here is showing you the SI joint. It's kind of a faint line. You can see it on both sides, but notice the triangular area here. That is the sacrum. Here are the ilium or the hip bones. The sacrum is in the middle. Where they meet is called the SI joint. Now, the SI joint can cause you some pain. Pain in the lower back, pain in the buttocks, hips, or pelvis, pain in the groin, pain limited to just one of the SI joints is normally what I see. Increased pain when standing from a sitting position, stiffness or burning, sensation in the pelvis, numbness, weakness, pain radiating down into the thigh and upper legs, feeling like your legs may buckle and not support your body. Now, symptoms of actual hip pain. So when we say hip, we're looking at the acetabulum, and also we're looking at the femur head, right? So here's the femur head. It fits into that joint. When that joint wears thin, that can cause pain. But hip involvement might include pain in your groin or thigh, pain that radiates into your buttocks or your knee, pain that flares up with vigorous activity, stiffness in the hip joint that makes it difficult to walk or bend. Now, we use orthopedic testing as well as x-rays to determine the underlying cause. So you can see that there is some overlap, I guess I should say. So I most commonly see a combination of hip and lumbar vertebral misalignment that causes pain. Here is a normal x-ray. So if you understand what normal is, you can tell the difference from abnormal. So when we say normal, we're looking at hips that are level. Now, these are not perfectly level, but they're close, and a spine that is straight. A normal lateral view, so the one we just saw is actually, let's say, looking from behind. This one is looking from the side. So we want to see a good curve. Then we want to see good consistent space between the bones. So the squares are the bones, the space in between is the disc. You'll notice this little oval shape, and that's called an intervertebral foramen. It's a fancy way of saying the hole between the bones. So your spinal cord runs back here, and between every single vertebra you have nerve roots. And those nerve roots, if they're compressed, irritated, or stretched, they can cause pain. Now we're going to look at a normal x-ray on the left and an abnormal x-ray on the right. So look how off the hips are. I've drawn a line from the top of one hip bone to the other, and it's 9 millimeters off. And look at this crooked spine. So you have to know that if your spine is out of a line like this, it's going to create muscular imbalances. It's going to create pressure on the discs as well as the vertebra. This line here, this arrow, is pointing to a spur we see. There are spurs all over this. So this is not something that happened overnight. This is something that happened over time. And we also notice a rotation in the lumbar spine, and that puts additional pressure and stress on the discs. So here's normal, here's abnormal. The question is, why are you hurting? What does your x-ray look like? Now from the side, this is a normal x-ray. Again, we're looking for good consistent space between the bones. This is the same person, but a lateral view on the x-ray that was crooked. So the blue arrow shows decent disc height. The orange arrow shows disc wear. So you can tell there's not as much space here as there is here. And actually the blue arrow, this person should have at least a third more disc. And then here, the first green arrow, we see very little disc space. Again, very little disc space. Again, very little disc space. So what that tells me is there's premature wear and tear. Think about it like the front end of a car. If the front end of your car is out of alignment, it causes premature wear and tear of the tires. This is what our concern is with misaligned lumbar spine and pelvis. The real deal is that as that disc thins, it causes not only calcium deposits, but it makes the hole that the nerve root comes through smaller. So there's a greater chance that that nerve is irritated or compressed, and that can result in low back pain. It can result in pain that runs into your rear end, pain that runs down your leg. It could be numbness and tingling all the way down to your foot. Now, if you have back pain and want to find the true underlying cause, I'm offering a $49 new patient special, which includes a consultation, an examination, and x-rays, which is normally a $260 value. So if you want to get to the bottom of your low back pain, feel free to call me at 205-625-3488. I hope this has been helpful. Thanks so much. God bless you, and have a great day. I hope you found that interesting and informative. Now, if you'd like to dig a little deeper into your own situation, call our office. We'd be happy to get you in and offer you a $49 new patient special. So that means you get your x-rays, your consultation, and your examination for $49, and it's usually $150 to $200 value. Thanks, guys. Have a great day. I hope to hear from you soon.